The Democratic Alliance has raised concern at the Gauteng Health Department spending of 14 million per year on 11 Cuban doctors. The figure was revealed by Gauteng Health and Wellness MEC Nomantu Nkomo-Ralehoko in a written reply to a question by DA MPL Jack Blom. The DA maintains that the decision is unjustified given the large number of unemployed South African doctors. Joining us to discuss this position further is Jack Blom. He's the DA Gauteng Shadow MEC for Health. Mr. Blom, welcome and thank you very much for your time. Now, you released a statement saying the employment of the Cuban doctors is outrageous given the number of South African doctors that remain unemployed. Can we start with just a bit of context around the employment of these doctors? When were they employed and under what condition? And I ask this just purely to establish whether the employment doesn't predate the non-placement crisis point that we have now reached.
Well, yes, it does. It stretches back many years, in fact, the employment of Cuban doctors. I've always been puzzled by it because they don't have the specialist skills that can't be done by local doctors. So it's in terms of a treaty, a country-to-country treaty with Cuba, and it's part of the Cuba doctor training program, which, in fact, the Western Cape province has opted out of that program and opted out of employing Cuban doctors, and Gauteng under the DA provincial government will do the same. So we've been employing Cuban doctors for some time. But we've always had unemployed local doctors. That's also been a long-standing problem. It's just bizarre that we spend all this money training local doctors, then so many of them are unemployed. It's between 600 and 1,000 countrywide. And I think there's 11 positions, plum positions, well-paying positions. They're being paid between 1.2 million rand and more than 1.6 million rand. And why on earth are we employing Cuban doctors when local doctors can fill these posts, gain experience, and give preference, of course, to local people? That's what it's all about.
What was the MEC's full response to that question of yours, pertaining to at least the duration of the contract? Because I understand that some of those contracts are coming to an end.
Yes, some of them just seem to be permanent contracts. So some of them are coming to an end this year, but the department didn't commit to cancelling these contracts. They said that they would evaluate the situation, whether they're going to continue with the contract. Well, a DA provincial government will just, cancel them all. I think we need to phase out this Cuban doctor training program. It's hugely expensive. When they go to Cuba, they have to spend a whole year learning Spanish, and when they come back to South Africa, they still have to do 2 more years at a local medical school. And from previous replies I've had to the MEC for Health, it costs more than double to train a doctor in Cuba than it does locally. So as we do in the Western Cape, the DA would give preference locally. All this money would be spent on local training and employing local doctors. Surely that's the priority in our country.
Now, 2 years ago, your colleague, Dr. Mimi Gondwe, had demanded that Labour Department share the skills transfer plan for the several Cuban nationals employed in the country. And this was, of course, to ensure that for the duration of their employment, they are, in fact, transferring their skills to South Africans. Have you seen the plan, at least for Gauteng?
I have to say I haven't seen it. Look, a lot of these doctors were employed during the COVID era, supposedly to help us out, but we didn't really need them. As I said, I don't think they've got irreplaceable skills that can't be done by local doctors. And it's time that it was phased out. We have excellent medical training schools. We have people graduating from them every year. And every year we've got community service doctors they can't find positions for. It's just an absolute scandal. And these are plum positions. Some of them are in Johannesburg, Sedibeng, Ekurhuleni. There's one at the Tembisa hospital and another at the Thelle Mogoerane hospital. I really think that these contracts need to be cancelled. We need to get good local South African doctors to fill them and, in fact, stop overpaying for training in Cuba, which is not appropriate to our local conditions. And it's just, I think, very important that any money available for health in Gauteng and in South Africa as a whole should be spent where the priorities are, not with this treaty with with Cuba, which I think, I think we should just opt out of it like the Western Cape has.
Now to the broader problem of non-placement of doctors. It is very concerning. And of course, last month, Minister Joe Phaahla, or at least earlier around February, committed that doctors would be placed by the 1st of April. Is this the case at least in Gauteng? Are you seeing some sort of movement in the placement of the doctors?
Well, they claim there has been, and I'm not convinced. I think there are still community service doctors that haven't been placed. And, every year it's the same problem. I don't know why they can't plan properly for placing community service doctors. And apart from that, there's, newly graduated doctors who have done their community service and they don't have a public service job. They're actually very willing to work in the public health sector. And as we can see, there's actually, 11 Cuban doctors filling positions that could be filled by South African doctors.
Now, Mr. Bloem, before I let you go, I just want an update on the telephone bill issue. Insofar as the Gauteng Health Department is concerned, that was something you were championing. You went on every platform to address this very important issue, that the phone lines weren't working. You had patients that couldn't call their family members, or even doctors or nurses among themselves that couldn't communicate in hospitals. Has this matter been settled?
It seemed to be largely settled. Finally, the department paid its bills. Last week, they said that the Carltonville hospital still had issues with their telephone. But, after many months of campaigning on this issue, it seems they finally settled their bills and it seems to be solved. But it's not just the non-payment issue. They have outdated telephone systems that regularly go off in the first place. So they need to modernize their telephone system, because it's absolutely critical that hospitals, you can communicate with the hospital. And I'm pleased that there's been progress, but that was only because there was a public outcry, and the fact that I got official replies on this matter to reveal the fact that it was because of unpaid bills. The problem is that the department always waits for a crisis before it snaps into action, and it took weeks and weeks before we finally got the bills paid and the phone lines working.
All right, Mr. Bloem, thank you very much for your time this evening. He's DA Gauteng Shadow MEC for Health. Now, we have reached out to the Gauteng Health Department for their response, and we'll bring it to you as soon as we can.